And this is developing right now live to SeaTac Airport, where there is new concern about a deadly virus that's already infected a man in Snohomish County. The new virus killed 6 people.
It has also sickened more than 300 in 5 different countries. We have team coverage, and we begin with KIRO 7's Lindsay Sheldon live at Providence Regional Medical Center in Everett. Lindsay, first off, how is this patient?
Steve, I can tell you that he is in satisfactory condition in a special isolation unit here at Providence Regional Medical Center. And we learned he asked for a phone to call his family. I also found out that he lives alone, was traveling alone, and had no pre-existing conditions that would have made him more susceptible to this.
There had to be the first case somewhere.
And today, health officials confirmed that first U.S. case of this new, at times deadly strain of coronavirus is in Snohomish County. Governor Jay Inslee quick to say,
the good news is the CDC, and we also agree that the risk is low to residents of the state of Washington. And this is certainly not a moment for panic or high anxiety.
Right now, we know the man is a Snohomish County resident in his 30s who traveled to Wuhan, China to visit family and arrived back in Snohomish County on January 15th.
He was not symptomatic on the flight, but as was stated earlier, this is a new virus, so we don't know when you're truly infectious. Like some viruses, you can be infectious a couple days before you show symptoms. We don't know that yet.
Officials say he also took a group mode of transportation to get home before getting treatment at a clinic on the 19th. He was put in isolation at Providence Regional soon after tests confirmed the virus.
Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health.
The outbreak in Wuhan is linked to a large food market, which suggests that the virus may have been passed from animals to people. But since then, human-to-human spread has been confirmed. The Snohomish County patient says he did not visit the market during his trip. Officials say the public shouldn't do anything differently unless they've recently traveled to Wuhan.
The point is to monitor yourself for symptoms if you've been in there the last few weeks. So looking for fever or cough or respiratory issues, much like this patient did.
Right now, there's a lot of work being done to try to figure out who, from health staff to patients, may have come in contact with this particular patient. I am working on that angle and also how this patient is actually helping health officials with their investigation. That's coming up at 6. Reporting live in Everett, I'm Lindsay Sheldon, KIRO 7 News.
The CDC started taking action against the spread of this new virus just last Friday. Screening areas were set up at Los Angeles International, San Francisco International, and New York's JFK airports. Today, the agency added Atlanta and Chicago O'Hare and plans to reroute all flights from Wuhan to those 5 airports.
There are 3 flights a day from China to SeaTac Airport, 2 from Beijing, 1 from Shanghai. But then there are several other flights from other Asian cities that could have connecting passengers, and that increases the concern here and across the U.S. KIRO 7's Ryan Sims continues our team coverage now live at SeaTac Airport. Ryan.
Yeah, Steve, talking about those connecting passengers from connecting cities. They will soon be coming here to baggage claim. Let me show you the arrivals board right here. The next flight is coming from Taipei. You can see it will get here at 6:10 p.m. And when those passengers get here, they'll be arriving at an airport that is making international news tonight.
Good afternoon, ladies and gentlemen. Welcome to Delta Flight 129, Shanghai to Beijing.
At SeaTac Airport, these China-bound passengers are headed into an unpredictable situation.
I think what I can do is to wear a mask, wash my hands, and stay away from the crowd.
I bought a lot of masks to bring back to Beijing because it's out of stock there.
A full 2 hours before this flight to Beijing, we found several passengers already wearing masks. Wen Jin was one of them.
If only they let us know earlier, maybe more people will be alarmed and wear masks, and then not so many people will be infected.
To keep others from getting sick, aviation officials will now be funneling Wuhan passengers through 5 select U.S. airports. SeaTac is not one of them, meaning any passengers coming here from Wuhan will be forced to stop elsewhere and be examined.
I think the more serious procedure, the better for public health.
This man told us the coronavirus reminds him of the SARS outbreak of 2003, when Asia witnessed a deadly health crisis that killed hundreds. It is a memory that still haunts this woman as well, who was picking up family at SeaTac today.
I was sent to the hospital during that time, so I had a very bad memory about that.
Flash forward to now, and here we are again. Plenty of vigilance about an emerging worldwide health crisis. And out of all the international destinations with service to SeaTac, latest statistics show that 4 out of the top 10 are from Asia. Live at SeaTac Airport tonight, Ryan Sims, Cairo 7 News.